My name is Makisha Smith. I am a nurse educator and I am here today to deliver a presentation about asthma here at your high school. A few facts about asthma are that it is a chronic disease that affects the airways. It's one of the most common long-term diseases of children. In fact, 1 in 11 children has asthma, and it affects about 10% of U.S. children between ages 5 and 17. In 2008, asthma caused 10.5 million missed days of school, and in 2009, 1 in 5 children with asthma went to an emergency department for asthma-related care. Overall, the most important thing to remember are that asthma attacks can be life-threatening. As far as the disease process of asthma, it is initiated by a type 1 hypersensitivity reaction. Lower airway inflammation is triggered by infections or allergens. This leads to inflammation, bronchospasm, and mucus production in the airways, which can lead to obstruction, as well as low oxygen in the blood. Obstruction in young children can be more severe because of the smaller diameter of their airways. The acute respiratory symptoms that we usually see in asthmatics are coughing, wheezing, and difficulty breathing. Regarding prevention, asthmatics have the ability to take control of their condition. They should know their symptoms. They should have an asthma action plan in place that includes daily treatment, what kind of medicines to take, and when to take them. They should be sure to share their plan with their school, any camps they attend, and anyone that provides care for them. They should take their medication exactly as prescribed, and they should avoid things that may cause an attack, such as cigarette smoke, dust mites, or pet dander. They should annually receive flu and pneumonia vaccines when they are available. Controller treatment is initiated in a sequence based on asthma severity and response. Asthma may be categorized as mild, moderate, severe, or very severe, intermittent or persistent, as well as controlled, partially controlled, or uncontrolled. The two main medications used to control asthma include bronchodilators and other controllers. Beta-2 adrenergic agonists, anticholinergics, and theophylline give rapid relief of symptoms mainly through relaxation of airway smooth muscles. The agonists and anticholinergics are given through inhalation, and theophylline are given orally. They reduce side effects and provide rapid relief, but have little effect on the inflammation actions. Controllers are categorized as inhaled corticosteroids. They reduce the number of inflammatory cells and their activation in the airways. Lung function improves over several days and prevents severe attacks. Corticosteroids may also be given orally or systemically and used for treatment of severe attacks. Periodic assessment must be done to decide to increase or decrease therapy as a way of monitoring treatment effectiveness. Before an increase is made, things to consider include medication administration techniques, environmental controls, comorbidities, and educational needs. Before a decrease is made, asthma should be well controlled for at least 3 months. Some topics that may influence compliance and adherence are the fact that a patient's perspective of condition and treatment should be considered, especially in children or adolescents or teenagers. We should consider what medication schedule will work best, and the provider should take your opinions into consideration. If you need help, using a telephone reminder may be necessary. Regarding health promotion, proper education in asthma management can reduce asthma-related deaths, hospitalizations, emergency department visits, missed days of work, as well as missed days of school. You should avoid smoking, obesity, and vitamin D deficiency, as these are behavioral risks for asthma. That concludes my presentation regarding asthma today.